Hello everyone. Now let us continue with the sections of implementing diagnostic stewardship. In this program, the roles and responsibilities of each member of the program needs to be delineated. The responsibility for delivering good microbiological diagnostic services is shared equally across clinical and laboratory staff at the surveillance site. The successful implementation of the program requires a multidisciplinary team approach as well as institutional commitment, including the allocation of appropriate human, financial, and logistics resources. The composition of this multidisciplinary team should reflect the existing organizational and administrative structures. Also, the scope of the work of the multidisciplinary team should be delineated. It should not be like that the scope should move to the quality objectives of the hospitals or other such other objectives. The scope of the work of this program needs to be very specific and needs to be followed stringently. Key areas of responsibility for each of the different professionals involved in diagnostic stewardship should be delineated. Intro training for all staff involved in diagnostic stewardship at surveillance sites. I said before, eyes can see what the mind doesn't know. So training is very important. Training for the clinical staff for conducting diagnostic activities, training for the laboratory staff on SOPs, training the data management of the staff at surveillance sites. So training needs to be conducted accordingly to each categories of the staff involved in the program. Let us now understand the monitoring and evaluation of activities of diagnostic stewardship. So we have seen the SWOT analysis. The SWOT analysis is the first step, that is the planning phase of this program, wherein we do the situation analysis and the resources and needs assessment are conducted. Then comes the input, that is the resources that is required for this program. That includes the funding that is required for the program, the local guidelines and SOPs, the trained staff on local guidelines, the microbiological laboratory facilities with equipment and consumables, and communication protocols and facilities. So these all things are included in the input or needed resources for the program. While the process or the activities includes mobilization and management of the funds, development of SOPs, protocols, policies, and guidelines, development and implementation of the training materials, implementation of the training courses, internal and external quality assurance of the laboratory, regular procurement and maintenance of the equipments and consumables, agreed means and frequency of communication among clinical laboratory and surveillance staff. While after coming the inputs and the processes, we come to the output. The output of this program includes sustainable financing and resources available on a regular basis, common understanding of protocols for diagnostic stewardship, staff trained for the program, increase in the specimens submitted to the laboratory. This is a result, a critical result. Increase, often it is seen that when we started the program, the specimens are sent in a very lesser number to the laboratory for diagnosis of infection resistance. So increase in the specimen is one of the significant output, and good laboratory practices in place, then patient treatment and surveillance actions should be informed in a timely manner, and that is another output of this program. After coming the output is the outcome. So outcome is a long-term game, which includes the patient treatment is guided by timely microbiological data, resulting in safer and more efficient patient care. Then accurate and representative AMR surveillance data to inform the treatment guidelines and AMR control strategies. So this is the comprehensive monitoring and evaluation program of diagnostic stewardship. As we now have understood the composition or the composition of the multidisciplinary team and the flow of the program, now let us understand how do we communicate the program outputs and outcomes to the stakeholders. Good communication between the different professionals involved, namely the laboratory staff, the clinical staff, and the surveillance teams, is a must and plays a critical role in successful diagnostic stewardship program. The clinical and the surveillance team and the laboratory must agree on the communication mechanisms and the channels. The communication mechanism could be either a meeting or through a newsletter or through emails, phone calls, and messages. So the team should agree on the communication mechanisms and channels. Regular multidisciplinary team meetings facilitate and improve the collaboration and foster the mutual understanding between the categories of staff involved in this program. So that was about communication. Let us now come to the diagnostic stewardship sections like pre-analytical, post-analytical, and temporal changes. So in this domain, in the pre-analytical domain, we have variations like optimizing the test utilizations and use of lab information system data and clinical decision support system. So herein, what are the implications of these variations? It includes diagnostic interventions, prevention of duplicate orders, improved knowledge of intended use, optimized test utilization. For example, restricting the classroom different orders to prevent the duplicate testings, it significantly optimizes the testing. So these pre-analytical things needs to be stringently monitored, and compliance needs to be improved in this pre-analytical domain. Now, in the post-analytical domain, we have variations like antimicrobial stewardship, audit, prospective audit forms, then clinical decision support system, then templated microbiological comments, then local contextual factors like surgery service and others, then implementation and dissemination science. So what are the implications of these variations of the post-analytical domain? It includes optimization of the antimicrobial utilization, then evidence-based guidelines used at the point of care, provides there should be a microbiological expertise that assess the clinical management. Then interventions are according to the local needs and abilities, and scientific methods are used to improve the sustainability and adoption of these program interventions. For example, comments on Canada species in urine culture and sensitivity report is very important because it is associated with significant decrease in the antifungal utilization. So that is about the post-analytical domain. If you see the temporal changes domain, it includes variations like learning curve or changes in this curve, standard of care or available treatments. So this includes implication of these variations include running period before the evaluating effects, or reassess diagnostic effectiveness with introduction of novel therapies. For example, performing and plotting the time series of respiratory and sinus testing, which reflects increasing effectiveness over time. So there is a change in the behavior of the clinicians in terms of testings and utilization of antibiotics. So these are the different domains and the variations and the implications explained with an examples. If you see the diagnostic pathway to recollect again, there is a clinical team, there is a laboratory team, and a surveillance team. From the clinical team, the patient specimens are sent to the laboratory team for the testings, and from the laboratory team is the lab results reach the clinical team. While in between them, in this flow, from the patient to the clinical team, and then from the laboratory team to the clinical team, again in the circle, vicious circle, there is a surveillance team involved, wherein the surveillance team collects the laboratory results from the laboratory team. It analyzes it, it sends it, reports it to the national AMS surveillance system, and also provides the guidelines and strategies to the clinical team for required for the program. Now let us see what are the pre-analytical diagnostic stewardship interventions. This includes optimizing test utilization. Laboratories should routinely audit their test menu in consultation with the clinical team. So there are most of the times in most of the healthcare settings there are visiting consultants or clinicians. So they should be aware of the test menu that is available in the laboratory, and the team should evaluate the relevance of the tests that are offered to to the clinicians to have a simplified and clinically relevant test menu as per the healthcare setting. Now, interventions such as to duplicate orders control may help avoid excess utilization. Labs should consider the drivers of appropriate utilization of the diagnostic test. To implement a duplicate order cancelling mechanism in an alliance is another such a way of optimizing the laboratory test. Underutilization or under testing for a condition should also be another thing to be considered when implementing a new test. Stewardship teams should ensure that intended use of new technologies is understood by the care teams and appropriately represented in the ordering system to ensure appropriate utilization for maximum benefits. Let's see what are the post-analytical interventions. The microbiology laboratory is a core component of the stewardship program, and simple modification to post-analytical communication of the microbiology results can significantly influence the provider behavior, that is the clinician's behavior. Interventions that involve actionable diagnostic testing combined with a real-time clinical follow-up. That's very important that microbiologists and clinicians should have interactions, and they should have a follow-up and communication channel that will facilitate the change in the or modification in the treatment or patient care. An impactful intervention will require a variety of disciplines. Now, I said before, it's a multidisciplinary program. So, the interventions will require a variety of disciplines and tactics, and it should be modifiable to various contexts and practices of the program. Evidence-based guidelines used at the point of care may help the microbiology results to clinical decision making.